Hello and welcome back to my channel. My name is May Rose, and for today's episode, I'm going to show you the medicines that I've used for an IVF round in a public hospital here in Norway, following the long protocol. So before we begin, I just would like to say that I wasn't paid for this video. I am not promoting any of the brands here, but these are the medicines that were given to me in the pharmacy, and these were the medicines that are used for IVF.
I've seen a lot of change, been through a lot of pain. Some things are not the same as they were a year ago, but all will be okay. I move on each and every.
If you're planning to conceive, it's also very important that you start taking folate and iodine supplements. So let's start. To begin with, I have here this box, which says gonapeptyl 0.1 milligram per milliliter. So this medicine is used for down regulation and to prevent premature LH elevation for women undergoing IVF. LH is the hormone in our body that triggers ovulation. So this medicine contains triptorelin acetate. It also has some salt water, concentrated acetic acid, and water. And each syringe has, I'll show you, each syringe has 1 milliliter medicine. This is administered subcutaneously, so I usually do it in my lower abdomen, around 5 centimeters away from the navel. So with injections like this, it's very important that you make sure to change your injection site to avoid tissue damage, and also it helps for better medicine absorption. So this is how the injection looks like after it has been used, but when you open this box, you'll find 7 syringes. So that's good for 1 week, but when it's new, it looks like this, right? But now it's used, so it's like that. And I just store all the syringes that I have used for this IVF round. Then it should be stored in the refrigerator, 2 to 8 degrees Celsius. And when you take it out, I can recommend that you put it on the counter for 10 to 15 minutes so it's room temperature, and then it's less painful to administer. This box is empty. There's nothing in it. So, but you have to store it in the refrigerator. So this is the medicine I start with. I administer this every morning at 6 a.m. from cycle day 19 to 24. It varies. For the first IVF round, I was told to inject on the 22nd, cycle day 22. And then the next one, cycle day 19, etc. So the clinic does the tracking of your menstruation cycle, and then they determine when you should start. So after about a week of using this, you should get your period. I usually get my period after 1 week. It's important that you get your period at least 3 days before you start using the next medicine, which is this one, Gonal F. For each round of IVF, I use about 4 boxes of this, and as I've mentioned, each box contains 7 ready-to-inject syringes. In 2024, a box of gonapeptyl costs around 420 Norwegian kroner, or 420 NOK. What are the common side effects of gonapeptyl? Where the nurse told me that I could get headaches, hot flashes, and mood swings, and that I could take paracetamol if I get those symptoms. And I did experience all those things, but they were manageable during the first and the second round. But during the third round, it became worst. It was the worst. I also had back pain and nausea. And well, it's because taking all these medicines plus working in a hectic environment with shifts and high level of stress, it could be very, very challenging. So, according to felleskatalogen, other possible side effects can be abdominal pain, nausea, vomiting, bloating or abdominal distension, inflammation of the injection site. You can get flu-like or cold symptoms, fatigue, hot flashes, vaginal bleeding, menstrual pain, ovarial cysts, ovarian hyperstimulation, pelvic pain, shortness of breath, back pain, headache, dizziness, depression, mood swings, abortion, weight gain, and visual impairment and blurred vision. So those are the possible and most common side effects of using gonapeptyl. But most women don't experience any of the symptoms. So it varies from person to person. I'll put the link to felleskatalogen on the description for a complete list of possible side effects and other things to consider or be cautious about when taking gonapeptyl. So after about 2 weeks of using gonapeptyl, I start with the next injection, Gonal F. So this one has more ingredients than gonapeptyl, but the main ingredient is folitropin alpha. Gonal F is used to stimulate your ovaries into making follicles, and it comes in a pen with adjustable dosage screw. So it also comes with several ready-to-use needles. Let me show you. So you just open this. You will find a paper with the things you need to know about the medicine. And then here's the pen. It looks something like this. So you have the dosage screw here, and you have the number here. This is also used because just like gonapeptyl, Gonal-F should be stored in the refrigerator 2 to 8 degrees Celsius. But just be careful not to freeze gonapeptyl and Gonal-F, right? So it should be 2 to 8 degrees Celsius. That's the standard. But however, once you've opened a pen, once you've used this, you can have this on room temperature, max 25 degrees Celsius for up to 3 months. And this is used, I'm going to open it. So it looks like this. It's also important to protect this part from sunlight. So you have to put the cap from lights, you have to put the cap back on. The dosage for Gonal-F depends on how your body reacts to this medicine. So during my first round of IVF, I started with 225 units. As you can see, we use IE. It's also on the box. IE. That means International NHET or International Unit or units. That's what we use. IE, it's Norwegian. How much that is, you can research, but for the purpose of this video, let's just say units. So after a week with 225 units, I got few follicles as shown on the scan. So they had to adjust the dosage to 450 units, which is the max dosage you can get for Gonal-F. And you can purchase a 450 units pen or a 900 units pen. So this one is 450. You can also get a 900 units. Each pen each 450 unit pen costs around 1,600 Norwegian kroner. And if you buy the 900 unit pen, it costs 3,200 each. O, diba? This is the most expensive of all the medicines I've used in IVF. So this is also administered subcutaneously every evening between 3 p.m. to 9 p.m. So for me, I just set my alarm for 6 p.m. So you take this gonapeptyl in the morning at 6 a.m. and then Gonal F at 6 p.m. And they are to be used simultaneously. So Gonal F, this one stimulates into making follicles, and this one prevents early release of the eggs, or early ovulation. So this is also easy to use. It's a 0, and then you just choose the dosage. For example, 225. I have it at, I take it at max 450, and then you just inject it into your lower abdomen, around 5 centimeters away from your navel. And then you count for like 10 seconds, and then you take it out. And rotate, change the injection site. Yes, and you can find instruction videos for this, but it's also important that when the first time you use it, you'll notice some drops. So there are some instructions on how to do it. Some say you should put it at like 25 and then you push it, because there's some extra medicine that you can use for that. But for me, I just put it on the dosage that I need, and then I put on the needle like this one. Maybe I can show you. I'm not gonna use this anymore anyways. You just push it like that, you screw it, then you take this out, and then you take this, and I do it like this, tap tap tap, and then you will notice that you can see that there's a little drop. So there you have removed whatever air or something, and then you just inject it. And when you're done, do not put this back. You take this, put it like this, and then you screw it, like unscrew it like that, and then you just throw this in a box with a cover. Okay, and then you put it back like that. So that's it. That's your Gonal F. Common side effects. You might feel that your ovaries are working, so there's going to be a little bit of pain. I've experienced lots of fatigue, and on Felleskatalogen you'll find 2 tables, one for side effects on women and one on men, because this medicine is also used for certain conditions on men. But for the purpose of this video, let's just name the possible and most common side effects for women. So you can get bloating, abdominal pain, diarrhea, nausea, vomiting, redness on the injection site. You can get allergic reaction, although very, very rare. You can also get ovarian cyst and mild to moderate ovarian hyperstimulation syndrome and headache. On rare occasions, this can also worsen your asthma if you have asthma. So yes, I usually use Gonal F for about 7 to 10 days simultaneously with the gonapeptyl. So when the follicles are around 20 millimeters in size and the mucous lining is around 9 to 11 millimeters in thickness, then you will be scheduled for egg retrieval. So you'll be given a precise time when to inject this, the next injection. This is used, so I can just do it like this to put it back in place. So by the way, when using Gonal F, don't worry if you, for example, exceed the dosage. Like, oh, I'm going to have 100, but then you put it at 125. You can always do it like this. Then you're back at 100, and then you just use it, right? So there, that's Gonal F. And as I've mentioned, after 7 to 10 days, when your eggs are ready to be harvested, then you will be given instruction when to inject the next medicine. This is a Vitrel, and I don't have the box, but the pen looks like this. This is also used So this is also administered subcutaneously. You have to administer the whole thing, which is 250 microgram or 0.5 milliliter. Injected around 36 hours before your egg retrieval. So it's very precise. Like I remember one time I was told you have to inject this at 9:10 in the evening. So you have to do it precisely at 9:10. This contains chorion gonadotropin or HCG, and this hormone will trigger the final stage of the follicle maturation. And you get your eggs ready for harvesting. So it looks like this, just like this one. And same thing, you put the needle on and then you put it to 250 and then do a little bit like this. There comes the drop and then you inject yourself. So like that. You count 10 seconds, pull it out, and you're done with it. So what are the common side effects of this one? It includes bloating, abdominal pain, nausea, vomiting, diarrhea, mild to moderate ovarian hyperstimulation, and headache. So this Vitrel costs around 600 Norwegian kroner. Pretty much the same side effects you can get from this one and this one. On the evening of the day after the egg retrieval, and given there were eggs retrieved, you will start with progesterone supplements. So I was put on this Vagitory called Cyclogest. I have to take this twice a day, morning and evening, and I have to use this for 2 weeks or until the test day. So this one, it's important that you lie down for about 20 to 30 minutes. After you injected this, you can help your body absorb the medicine. Each box costs around 220 kroner and it contains 15 Vagitories, which is good for 1 week. And it's not open yet, but it looks a little bit like a suppository, but this one is a Vagitory. So it looks like this. So some women say that this can be used also as a suppository. I've never done that because otherwise it would say here on the box pessary or pesar. That means that you can use it either as a Vagitory or a suppository, but it only says Vagitory here, so I'm only gonna use it the way it was intended to. Vaginal anvendelse, vaginal bruk. Okay, so common side effects of Cyclogest are bloating, abdominal pain, constipation, fatigue, night sweat, bleeding, breast pain, pelvic pain, joint pain, sleepiness, headache, dizziness, metallic taste in your mouth, frequent urination, mood swings, and weight gain. So pretty much the same symptoms as in pregnancy. So there you have it, guys. So these are the medicines that I've used during the IVF treatment in a public hospital here in Norway following the long protocol. And I probably make another video about the total costs of the treatment. But here in Norway, we have subsidized program for this. So the government pays for much, or we get refunded what we have paid for with the medicines, and then we pay 15% of the procedural fees in the hospital. But I'll talk about it in another video. So these are the medicines that I've used, or I personally used after as prescribed by my doctor. I know that some women, they can use other forms for this medicine. It can be nasal spray, and it comes in other nouns, other virkestoff or other ingredients. But yeah, it varies from person to person. It depends on your needs, and it depends on how your body responds to the medication. And if you like this video, please like and subscribe, and I hope to see you in the next episode. Thank you for watching. Ciao, ciao.